I'm Nicole. I'm a teacher owner here at Pilates in Common. So when a student comes here for a lesson and they have back pain, one of the lesser known areas of the body that we tend to work on are the feet. And we do that because they are the first point of contact to the ground, but their influences don't stop there. They actually continue up your kinetic chain through a myofascial network that's pretty freaking awesome. The image here shows this network, and the blue lines represent how the feet connect up to different musculatures, both in the front and the back of the body. And what's cool is that this image is showing us that how we engage our feet, how we stand into our feet, directly impact our ability to stabilize the core, activate our glutes. They can even improve the way that we breathe. And all of those things are foundational if we're going to protect our back. So the foot has two jobs. It needs to stabilize and it needs to mobilize. For example, when you're taking a step forward, maybe you're running or you're lifting your arms up overhead and coming onto the balls of your feet to grab something off a shelf, your foot needs to become rigid and stable in order to propel you forward in space. The opposite is true if you're landing a squat or bringing the heel forward to step. The foot needs to become more mobile. It needs to become receptive to the surface area you're standing on so that you can absorb shock. Enter the tripod of the foot, which are three bony landmarks: the big toe metatarsal, the pinky toe metatarsal, and the heel, the calcaneus. And that's where our arch system comes together and spans the whole length of our foot like a dome shape. So it gives us that ability to be rigid when we need to propel ourselves forward, but then to be mobile and adaptable when we need to absorb shock. So today, Destiny is going to teach us a class around the foot. It's not only going to help us identify what parts of the tripod you prefer to stand in and how to stand through the center of the foot, it's also going to help you understand that kinetic chain we talked about and how the feet can translate up into the strength of your core, into the strength of your glutes to ultimately protect your back.
Hi, I'm Destiny, and I'm a teacher owner at Pilates in Common in San Francisco, California. And today I will be teaching Nicole, another teacher owner at Pilates in Common, a little foot class. So to start, I'm going to have Nicole do a body scan to sense her weight distribution into her feet. So actually, before we start, I want to ask Nicole, is there anything that you know about your feet that seems unique or is particular to your body?
Well, I don't know if it's unique, but I definitely have tight calves and tight ankles.
Okay.
Pretty rigid foot. When I came to Pilates, I lived in more of this kind of like bow-legged position. So I'm often trying to figure out how to get my legs more in the center of my foot. And then all that tightness shows up.
Okay.
Yeah.
Cool. Great. Just want to point out a couple things is that I asked her about her feet and she responded talking about the ankle and the calf. And that's going to be a pretty common theme kind of throughout today's class is that the foot is not a standalone piece of your body. The foot relates to your ankle, it relates to your calf. The ankle is between the calf and the foot. There's actually not an ankle bone or an autonomous ankle.
Right.
Yeah. Okay. Great. So back to the body scan. I'm going to have Nicole close her eyes. And if you're following along, that's important. You want to lose that sense of vision. And then she's just going to give herself permission to go inside of her body and sense her feet on the floor. Now, the other thing Nicole is going to not do is move. She's also not going to touch herself. She's literally just trying to feel the weight into her feet. So, Nicole, if you had to describe your footprints, how would you describe them on the floor?
I feel like my feet are more on the outer edge, like more on my pinkies.
Okay.
I feel like on my right foot specifically, my big toe is having like a hard time trying to stay rooted, and my knees are definitely wanting to like kind of rotate in and push back.
Okay, great, awesome. All right, again, you'll see, right? I asked her to describe the feet and it's relating up to the knees. So interesting there. Important to know where you're starting from so that you can actually assess change that happens after movement. From here, you're going to need 2 towels and then we're going to roll them up. Okay, great. So I just folded it in half lengthwise and I'll fold it again. And then I'm just going to roll it into like that.
A burrito.
I know. I'm like, why do I want to say tamale?
It's
like a tamale.
Yeah.
Okay. So then what you're going to do is you're going to place these towels on the floor. And I'm going to have Nicole step her right balls of the feet on the front towel. And then she's going to pick her heel up to step on the back of the towel. And go ahead and find a little split stance for me. So have your left foot behind you. Yeah. Yeah, even a little bit more. I'm gonna have you like basically do like a lunge. Okay. Okay. So what we're doing here is we're suspending the medial arch, which is the arch everybody knows about. This middle arch that's really creating a doming shape, the arch that typically will fall. And if you've ever had orthotics, it's usually addressing this medial arch. We're suspending it between the metatarsals and the heel so that we can allow it to move. It's going to flatten a little bit into the depression created by the 2 towels. And then when I ask Nicole to take weight off, it will spring back. We want that medial arch to be springy. Okay, so from here, you're just gonna go ahead and let yourself lunge forward. And the idea is that you are trying to let your foot, the portion that's not touching the towel, stretch downward into the space. Now, that might result in a little bit of an Achilles stretch or a calf stretch.
Calf for sure.
Calf for sure. And again, not a bad thing. When you come into what's called dorsiflexion in the ankle, flexing the ankle, it does put a stretch on the calf. Great. And then you can come out of there. So you're just going to do that a few times. You have 26 bones in your feet, and in between each of those bones, so where 2 bones meet is a joint. You have 33 joints. So when I'm having Nicole here, just by letting the foot kind of move downwards and then spring back up, is I want the joints of her foot to be able to spread apart and then collect again. Nice. And then, like we've been saying, this is also giving her a calf stretch, and the flexibility of your calf will directly impact your ability to stand into your foot. Okay, great.
Other side?
Yep, go ahead and do the other side. Nice.
So I did about 5, so I'm gonna do about 5 here too.
Yeah. And while you're doing this, you can just find your breath here. Yeah, and you can actually see the difference between Nicole's right foot, right ankle, and her left. Notice here in her left, she actually has a bigger range of motion through that dorsiflexion. Does that feel true to you? Okay.
Yeah,
Does that,
definitely.
yeah. How does that feel through the bottom of your foot when you lean forward like this?
I feel like I have more room to go. Like I can actually move forward as opposed to the other side felt super restricted. Like I was like, oh, and there's my end.
Yes, yeah.
Tight.
Great. Hopefully you guys can see that on the camera too. It's, I don't know, to me I'm like, oh yeah, okay, that's obvious.
Okay, I think that was about 5.
Great. Okay, excellent. Nice. All right. So then from there, I'm actually going to go ahead and have Nicole stand on this towel. And we're on a little bit of a slippery floor. So if you have like a carpet, that's like really ideal. And I want Nicole to just actually start to kind of rub her feet around on the towel. Yeah, exactly. You have hundreds of thousands of nerve endings in your feet that are talking to the rest of your body, kind of up the chain, right? Up into the knee, up into the hip, up into your core. So we're just stimulating those nerve endings. Do you feel like your feet are getting a little bit hot, a little bit warm?
Yeah.
Good. Nice. Great. Okay.
Cool.
Awesome. Okay, and then go ahead and step off of that towel. And next I'm going to have you come seated here. Okay. You'll take the towel and you can just like kind of hold on to the ends of it like that. And I want you to lean over and I want you to shimmy on the top of your foot, actually.
Oh,
yeah,
top.
we're going to
Okay,
get to there too. But I want you to shimmy to the top of the foot. Yeah, exactly. Great. So just kind of, again, waking up those sensory nerve endings. Yep. And you can actually come up through the ankle and all the way up the front of your shin. Your foot has what's called intrinsic muscles, which are muscles that live within the foot, and then also what's called extrinsic muscles, so muscles that control the foot but are outside of the foot. So some of those are up through the front of your shin or the side of your shin, and then also through the calf. Great.
Yeah, it feels good. It's kind of like you're hydrating.
Yep, totally.
Something.
This is going to increase blood flow as well. Blood flow decreases stiffness. So since you mentioned you have a stiff ankle, it's really great. You'll go ahead and do the same thing to your calves. So you're just going to rub. Low. Yep, rub the calves there. Great.
And this is great because anybody can do it.
Yep, anybody can do it. All you need is a towel. You don't even need a towel. You can totally use your hands. I always recommend doing, like, if you had 2 minutes and you had to pick one thing to do before you go for a walk or before you go for a run, rub your feet, rub your calves, and rub through the shins.
Whew, little arm workout too.
Yeah, totally.
All right.
Okay, awesome. Cool. From there, you'll go ahead and come up to standing again. I'm going to teach Nicole is called toe extension. And what that is having her pick the toes up at that first metatarsal. That can get lost. That movement can get lost as we age. So important to just keep practicing, keep that brain-body connection alive. So Nicole's going to find the balls of her feet pressed down and then just pick the toes up from there.
So then this would be the top part of my tripod, the big toe metatarsal and the pinky toe metatarsal.
Yep, exactly. And the muscles that are doing that, it's pretty cool. You can see it here. There are really long tendons that go down the front of your foot on the tops of the toes, and that's the lever. And I always think it's really interesting just to know where the muscles are that are moving you. So the muscles that are picking her toes up are above the toes. Yeah.
What's also interesting is that I have more range in the big toe because I always want to roll off. So I have to really focus on letting my outer toes do just as much work as the big toe so I can stand in that tripod and not roll off of it.
Totally. And you can see here that right big toe is having a harder time extending, right? Yeah. So you have to like really send your brain power there. I always think about that scene from Kill Bill where Uma Thurman comes out of the coma and she's sitting in the truck and she's like trying to move her big toe.
Yeah.
I mean, that's really
exactly what I have to do.
Exactly. Okay. Okay, great. Then from here, Nicole's actually going to keep her toes picked up. And the next skill that I'm going to teach her is abduction or abduction of the toes or adduction of the big toe because you're pulling towards the midline. But just like your fingers, right, you're going to try to spread those toes apart. I know, and it's hard and it might seem like impossible, but the more you think about it and try to do it, you're going to get a lot out of just the ask, even if you don't see your toes spread. Then could you keep the toes spreading here, Nicole, to lower the toes back down to the floor?
Toe sweats.
Yeah. Okay, great. Toe sweats. Yep, you're going to do that again. You're going to pick all 10 toes up. Nice. And then you try to spread those toes real nice and wide. Good. And then you're going to lower the toes back down. Great. Now, what's really cool, go ahead and pick up all 10 toes, and you're going to pause there. And can you describe how picking up the toes affects your foot?
Yeah, so I can definitely more clearly feel the tripod, but what I'm noticing the most is how the muscles in my inner quad, so like my low quad, are really pulling up through my inner thighs. I can feel like this deep sensation in my abdominals.
Oh, butt's quivering.
Yeah, because my heel is actually standing. Yeah, it's weird. Yeah.
Cool. Okay, awesome, right? Just goes to show what happens up the chain, right? When you have this nice mobility through your toes.
I got to put them down.
Yep, put them down. Okay, great. Now, just in case anyone out there is wondering, like, okay, who cares? She can pick her toes up. I just want to point out that when you're walking, right, that propulsion phase, back foot, it's the same motion through my toes. I'm extending my toes to pick my heel up. So every time you take a step, you are doing that motion.
Yeah. Driving through the ball of the foot.
Yep. Right. And then when you flex and you're moving your foot forwards, you got to pick the toes up in order to flex the ankle to clear the ground to move your to put your heel forwards. Okay. Nice, Nicole. Great. All right. So then next thing here is we're going to pronate and supinate the the foot and the ankle. So supinate is she's going to come onto that pinky toe side of the feet. And the way that I like to remember supination and pronation is if I had to hold a cup of soup, how would I do it? It's kind of weird to think about with your feet, but any of you people out there holding cups of soup with your feet, you know what I'm talking about. Okay, now I want to take this moment to point out when Nicole stands more on this pinky toe side of the foot, which is called the lateral arch, okay, the arch that helps you with balance. I want you to notice what's happening up the chain. Notice that her knees are bowing outwards. And this is what's called knee valgus, okay? Then when I have her, see, I gotta do it in my head, I'm like, this is supination. Okay, so when I have her pronate, which means that she's gonna have her weight standing on the inside of her foot, it's going to collapse this medial arch. Look at what's happening up the chain. Notice how her knees are knocked now, right? So that's called knee valgus. And this is going to put a lot of strain on the ligaments on the inside and the outside of her knee. Okay, go ahead. But, I mean,
still healthy movement.
Yeah, healthy movement for sure. Healthy movement. My whole point in pointing it out is if this is your pattern of movement, it's going to result in a little bit of wear and tear through the feet.
Totally. And if it's only available to you like on one side, then you're going to kind of get stuck there and you're going to lose your ability to transition out of it, right?
Yeah. Cool. However, I will point out that the pronation and the supination, and it is movement that you need in the body, but you want to manage how much of that movement is available.
Yeah.
Okay, plenty of those. Okay, great. Then from here, we're going to take it back and we're going to try to add a little bit of movement into those skills. So you're going to extend your toes. You're going to pick those toes up. And this next thing is called the Frankenstein Walk. So Nicole's going to start to walk forwards and walk back, and she's going to try not to set her toes down. She's going to keep those toes extended. I'm doing it too as you're doing it.
Moral support.
She's going to keep her toes extended, and she's going to walk back, and she's going to walk. Yeah. Okay, now she's walking back. She walked forward, and she's walking back. Yeah. Ooh, that's tough. Right. Okay, go ahead and just go forwards, back one more time.
Yeah, I can really feel, again, the tripod.
Yep.
And if I don't drop my toes, I'm a little bit more purposeful about shifting my leg and my pelvis weight onto the center of that foot.
Yeah. Does it also feel like it makes you flex your ankles?
Oh, yeah, that's like 100%.
Yeah.
It's like something that I'm like, can I not do that, please?
I know. Yeah.
But it's very, very clear.
Yeah.
Right
totally.
now. Yeah.
Okay. Excellent.
Okay.
All right.
Cool.
Nice. Okay. So now I'm going to transition Nicole into seated, but I want her to pronate so that she's going to be more on the balls of her feet or the inside of her foot, right? Her knees are going to be a little bit valgus there. Okay, great. And I want her to do a little squat to the chair. You're just going to tap your butt and then you're going to pick yourself right back up. Okay, then I'm going to have her supinate, so coming onto the outsides of the feet. Yeah. Okay, do a little squat. Great. Now, can you find the tripod of your foot? So big toe ball, pinky toe ball, and that center of your heel. And try to stay weighted into the tripod of your foot to do your little squat.
Let me do it again.
Nice.
Yeah. I really have to think about those points kind of equally moving away.
Right.
So that I don't roll out.
Yeah, good. And then go ahead and stand yourself up. Okay, nice. So before she sits down again, I'm going to show a really nice way to find the tripod of your foot if you're ever going to do like weightlifting, squatting. Okay, so go ahead and stand. You're going to be in like a little split stance again. Okay, so here you're going to let the weight come into the heel, and that's all that gets to touch so far. All right, now you're going to feel the weight of that pinky toe side of your foot start to articulate with the floor. Yeah. Ooh, do the pinky toe.
Yeah, you gotta really reach it, right?
Yeah.
It's like
Okay. Right.
witchcraft.
Exactly. So that pinky toe is down, the pinky toe side of your foot is down. And here's the hard part. It's like piano fingers, right? You're going to try to go that fourth toe down, right? The middle toe down, right? All the way until you feel the big toe down. Find that big toe ball.
I got a cramp.
Yep, got a cramp.
Yeah,
Okay.
got a
That's
cramp.
not a bad thing. You feel a cramp where?
God, in the transverse arch, so right across the big toe to the pinky.
Okay, great. Cramp is not necessarily a bad thing. Cramp can mean that we're activating something that hasn't been activated. So Pilates teachers get really excited about that.
We're like,
okay,
woo,
right?
cramp.
So that's a nice way to find the tripod of the foot. Okay, great. And then can you stand into that tripod of the foot, right? Good. And this is where you're trying not to flatten the foot. Yes, exactly. So that means you have to have an active foot.
Right.
Then you're going to bring your left foot next to that.
Yeah.
Okay, good. Then from there, you're going to sit down onto the chair, a little trust ball there. Okay, nice job. So the next thing we're going to do is called Footspine. Okay, so the deal is you're going to go ahead and let one of your feet come out in front of you.
I'll do the other one.
Okay, nice. All right, so again, 3 arches in the foot. Okay, the arch that's across the metatarsals is called the transverse arch. The transverse arch helps you with different types of terrain. So you're hiking over rocks, right? That's one way that your foot has to adapt. And then when you're in sand, that's another way the foot has to adapt. Transverse arch is really going to help with those different types of surfaces. Okay, that's across here. Then you have your medial arch, which we've already talked about, right? That's your main like springy shock absorbing arch. And then you have the lateral arch, which is along this pinky toe side. I know, I'm tickling you. And the lateral arch is is going to help you balance. Okay, great. So from here, we're going to treat the foot like a spine in that we're going to try to articulate from top to bottom. The top are the toes. So I want you here, Nicole, to start to point your toes forwards. Yes, and I want you to think about almost like the toenails are trying to point more forwards and down towards the floor. Really good. Instead of the pads of the feet. Now you might feel a little cramp there. Okay, great. Now, what often happens here is, can you scrunch your toes for me? Like this? Yes, that's not what we're after. Okay, we're not trying to scrunch the undersides of the toes. Most people already have over scrunched toes because of the footwear they use. But what we are trying to do is squeeze the transverse arch, which again is at that metatarsal line. Yeah, so you got, I know, yep, so you got to keep those toes long and the toenails try to arc. You will feel that underneath the toes, right? But you don't want to overdo it. Okay, great, nice. Now, can you think about squeezing below that transverse arch as if you're trying to squeeze the bottom, the lateral arch and the medial arch so much that it would allow you to touch the toenails, the tips of the toenails, down towards the floor. Now, this is the type of foot that a ballerina stands on. Okay, great. Then from here, you're going to keep reaching those toenails down, and I want you to start to pick up from ankle flexion. Yep, right. Exactly. So there's still this reach forward. You're still squeezing the transverse arch. You're still reaching the toes forwards, and now you're really flexing the ankle. Your ankle flexor, can you feel a little bit of this lighting up? Yeah. Yeah, exactly. Okay, good. Now, from here, you finish with that toe extension. Yep, great. Go ahead and switch to this foot.
Okay, so then for the foot spine,
Yep.
the toes would be the head, the ball of the foot would kind of
exactly.
be the rib cage,
Yep,
the center
exactly.
would be the belly.
Right. Thinking about if you're flexing the spine forwards from the top to the bottom. Yeah, exactly. Okay, great. So same thing here. Ooh, hard. Okay. And it's interesting on the you notice on the right side. Yeah, totally. And, you pointed this out in the beginning, you know a lot about your own body, whether or not you know that about yourself or not. But you can see that this big toe is having a harder time staying in its lane.
Yeah.
Right. And so that's something that you would want to work on in another session. Okay, great. Right. So toenails are really trying to arc down towards the floor, right? It's not a scrunch of the toes, it's a squeeze of the transverse arch. Right. Yes. Yes. Ooh, okay. This is really interesting. Okay. And tell me if this is true. It looks like to me that it's harder coming into that like ballerina foot, or what we would call bird on a perch in Pilates, not only because this medial arch is having a hard time squeezing, but also because this lateral arch is having a hard time squeezing. Yeah. Okay. Okay. Cool. All right. Then, yep, you're going to start from the bottom to the top by flexing the ankle and picking the foot up. Nice. Right. 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 And then you try to pick those toes up. Nice.
Yeah, there's just not as much range.
Yeah. Okay. And then, the bodies are not symmetrical, even though we'd really like them to be.
Yeah.
Okay.
That's why it's good to ask it.
Yep. So Nicole might want to spend a little extra time on her right side, since that's the side that is a little stiffer, a little bit less mobile. So, perhaps she would do like 5 or 8 on this side or come back to the side and do it twice versus just maybe once or 3 times on the left side. Okay.
Yeah.
Great. Okay. Nice job. All right. So now we're going to tie it all together with some standing footwork. Nicole, stand in what's called Pilates V. Yeah. Okay. And I'm going to add toe extension to this just to practice that a little bit more. But first, Nicole is going to pick the toes up off the floor, that toe extension. Oh, wow. This is really cool. Already you can see like the alignment of your knees is a little bit different than when you started, which is great. Okay, wonderful. Then she's going to spread those toes and lower them back down onto the floor. Great. And can you feel the tripod of your foot? Great. Okay. From there, I want you to think about sending your shin bones forwards towards the front of the tripod. Now, that is not permission to lose the pressure down into the heel. Okay, still feel the tripod.
Yep.
Great job. Okay, now notice that I didn't cue her to bend the knees. This is not about bending the knee. This is about letting the ankle bend into the tripod of the foot, into the center of that foot where Nicole was describing previously. Okay.
Tight.
Yeah, tight. Okay, great. Now here, feel your big toe ball and your pinky toe ball in the pads of your feet. Great. You can start to let a little bit of that weight shift out of your heels so that you pick the heels up. But this is not just as simple as picking the heels up. She is picking her arches up so that she's still standing in the center of her foot. Okay. Yep, you got it. Okay, good. Now, stand into your arch, Nicole, to press your legs to straight. Right, this is that stable foot Nicole was talking about. Nice. Then from here, stay weighted through the big toe ball, pinky toe ball, and you're going to lower your heels down with control, finding ankle flexion. Good. Okay, great. You can do that one more time, right? Shins come forwards. That's the shin bones coming forward on that talus, the top of the foot bone, right? Ankle flexion. Then you pick the arches up. Keep finding weight through that right big toe ball. Yes, good, 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 good. Keep finding weight to that right big toe ball. That's going to help to pick up your inner knee, right, up into your inner thighs. Yeah, you got it. Okay, right. Now, Nicole's being a little shy. She can do more. Right, right. Can you really push down through the big toe balls to really pick your kneecaps up, right? To really stretch your hip flexors.
Yeah.
Okay, then you're going to lower your heels down. Oop, but don't let it go. Right? Don't let it go. Don't let that into the
Yep.
Right? Yeah. Yep. And you can see what her body's doing. It's so interesting, right? All her body knows is that she's trying to bring her heels down. So it's going to just try to leverage her. It's going to try to move her body weight around to bring her heels down. But we want Nicole to control her body weight into gravity, right?
Yeah. And the body's always going to take the less path of resistance.
Exactly.
So if I don't want to flex my ankle, I'm going to go, so I don't have to.
Right. Okay, great. Now we go into the reverse. Okay. So from here, You're going to push down through the front of your tripod. Let that help to pick up your medial arch. Let that help to pick up your inner knee line, right up into your inner thigh bone line, up into your lowest belly. Good. Okay, so that when you go to move your shins forward and flex your ankles, there's not this drop of weight. You're still suspending your body weight in the arch and in the foot. Good. Okay, now control your body weight to flex the ankle further to let the heels to come down. Oop, keep finding that right big toe ball. Don't let it go. Right big toe ball. Yes, there we go. Nice. Now, find the tripod of your foot to stand yourself up to straight. Nice. Good. And then you'll reverse it. I mean, same thing. One more time is what I meant. Yep. Okay, great. Nice. And one of our roles as Pilates teachers is to get whoever's doing the exercise to do more of it. So come back to straight for me, Nicole. Yep. Push down through the balls of the feet like you mean it. It's not pushing your knees backwards. You're still keeping your shins forwards. It's picking your kneecaps up. Right. Okay, good. Then from there, lower the heels down. Oop, yep. Be nice about teaching Pilates teacher. She knows where we're going. Yeah. Okay, good. And then, yep, ankles are flexed. Then think about controlling your heels down. And it's not by flattening your arches. It's by doming your arches more. Right. Ooh, that's so good through your right medial arch. Good job. Good job. Look at me doing this weird dance. Okay. Then stand into your arches. Now, be careful, right? When you press yourself up to straight, if you stand into your big toe balls, it's going to pick your kneecaps up. Okay, anybody out there with hyperextended knees? This is the reverse of that.
Yeah.
Good. And rest.
Okay.
Okay. Now we're going to do the body scan again to check in to see if that weight distribution into Nicole's foot has changed at all after those exercises, right? Mindful movement. So she's gonna have her eyes closed. She's not gonna touch herself. She's not gonna move. Give her permission to go inside of her body. And is there anything you notice right off the bat that feels differently than when we started?
Oh yeah, well, I definitely can feel that my knees are pointed more forward.
Yep, I would agree with that.
And I feel like my weight is more in the front, like in more traveling through the center midfoot as opposed to before it's like more like pinky edge of the foot. So I know that I've done something that allowed me to anchor that big toe a little bit better.
Great. Okay,
Yeah.
that's awesome. Okay, so right, remember from the beginning, Nicole felt like she was in a stiff foot, that she was on that lateral side of her foot a lot. And you felt, it's so funny that you didn't immediately mention any calf tightness, because that was one of the things that you mentioned right off the bat in the beginning.
Yeah. I often will feel it more in as a rotation in my knees, but I know from experience that my calves are tight.
Yep.
But I mainly feel the tension in the front of my ankle, even though I'm like, that calf.
Yep, totally. Okay, that's awesome. Great. And then you're able to find that right big toe ball a little bit better.
Yeah.
Nice. Okay, so now Nicole is just gonna walk herself out of here and she's ready to go for a walk.